The forgotten few, the Russian children suffering from a rare and incurable genetic disease which can leave them badly scarred and in acute pain. Until now, it's been virtually ignored by the medical establishment, but one mother is hoping to change that. You may find some of the images in Daria Pushkova's report upsetting.
She likes dancing, and no one would guess the amount of pain Lisa goes through to make these simple movements. Lisa has a rare genetic condition, epidermolysis bullosa, or EB, that makes her skin as thin as a butterfly wing. A slight touch or a hug can cause painful blistering that takes a long time to heal, leaving the skin even more fragile. Around the world, sufferers like Lisa are known as butterfly children. However, in Russia, it's as if they don't exist.
The doctors simply don't know of the disease, and when you tell them what it is, they might have heard of it, but they don't know how to deal with it.
Lisa is only 5, but she already knows her diagnosis better than any doctor. Her mother knows there is no cure. With proper medication, her daughter could lead an almost normal life, but it's way too expensive.
It's such a rare disease that it's pretty much been forgotten about. There's no state support, so there's no money and no specialists.
Vera Albanova is a dermatologist and admits she's become a specialist by default. No one else is dealing with EB patients, but the mothers say her advice can conflict with what they've learned from abroad.
Well, it's a very complex disease with so few patients suffering from it. Any doctor that would take it up would have to become a very narrow specialist. I myself am tied up in many other places, so I don't have much time for these patients.
2-year-old Nastya is a clear example of what good care and access to proper treatment can do for a butterfly child. Her mother says she's probably the only girl in Russia who from the very first days of her life was taken care of properly, according to international standards.
When she was 25 days old, I took her away from one of the best maternity wards in the country. Her stomach and feet were raw, and the marks of the doctor's fingers are still in her skin. Back then, she did look like an EB patient.
Ever since, Nastya has lived a life of protection. Her medication costs roughly 100,000 rubles, more than $3,000 per month. She has 3 people constantly looking after her, including her mother. Julia says life expectancy for such kids in Russia is very low, and she'll do anything to make her daughter's life long and happy.
She's my beautiful and long-expected princess. And if there is a pea that can hurt my princess, I'll take them all away, no matter what the cost.
Julia is also behind a newly created foundation to help other children. Now people from all over the country are calling her, and it seems the number of suffering children is far greater than the previously estimated 100. As for Lisa, she bravely takes on life with a smile, despite her deteriorating state. As a sign of trust, she told me her biggest dream.
There may be few children with this disease in Russia, but each of them needs all the support they can get. They may have learned to live with their condition, but just like Lisa, they all dream of one day waking up to a life without pain. Daria Pushkova, RT, Moscow.